Hi guys, week 11 out of 15. I'm sorry I'm sending this a little bit late, but it's been hectic. Um, we're submitting a lot of research for the Greater New York ACSM chapter November meeting, and the deadline is tonight at midnight. So, yeah. Um, Today we're gonna cover, and we're gonna talk about what you submitted. Um, we're gonna talk about what you have to submit until next Sunday. I'm going to try to cover 3 chapters, so I have a little bit less next week. And I want to mention before anything else that I moved the office hours from tomorrow to Wednesday. So it's from 8 to 12:30 on Wednesday, same time, different day. And I have added, excuse me, I have added a synchronous meeting on Thursday at 12 noon. That will be for 45 minutes. We don't need to use the whole thing. It is there so we can talk, communicate, so I can get some feedback, positive, negative, whatever. And of course, that will be another chance for you to get extra credit. That will be our 3rd synchronous meeting. I'm planning on having 5, so one, probably the 4th one the week before Thanksgiving, and the 5th one during finals week. All right, so let's start. I'm going to share our Moodle site. I'm going to go all the way down right here. So for LO 19, you did very well. I'm very proud of you. Excellent work. And a lot of interesting opinions. I have already sent out the feedback. Now for LO 20, I wish I could say the same. You did not follow instructions. Some of you, I'm doubting you even have the book, which is unfortunate because you know it is mandatory to have this specific textbook. Again, I will give you the 3 basic steps that you need to do. The pages again from our textbook is 433 and 434. That's where you will find the 2 formulas. Before you do anything with the formulas, you use Fox's equation, which is 220 minus your age, to find your age at max, which means if you're 20 years old, it will be 220 minus 20, 200, 200 beats per minute. That would be your age at max. And then you use my percentages, the 70 and the 94. So it's 0.7, 0.94. And you use that and your age at max to find the age range using the formula on page 433. And the formula on page 434, which is known as the Carbonian method. You do something similar, but in the Carbonian method, you add your age at rest. How do you know your age at rest? Well, you just rest for a little bit, relax, and then you just figure it out. So you can figure out like this or like this, right? You can just measure how many beats per minute bits you have in 15 seconds and then multiply it by 4. So the Carbonian method has that extra step, which is you add your age at rest. Please try to do that again, revisit those pages, find your age at max, use the formula on page 433, and then use the formula on page 434. Do not forget to add your age at rest when you're using the Carbonian method, okay? Now for next week, we have 2 LOs, LO 21. So I want you to 2 paragraphs, and I will suggest in the first one, you write about the benefits of flexibility training, and in the second one, you write about the risks of flexibility training. Okay, that's it. I'm going to cover today too. but that's LO21. For LO22, let me move this. For LO22, these are the articles, a lot of articles, all of them are very important. Just pick one. Pick one, whichever you want. I'm not going to tell you which one. And what I want you to do is present the take-home points. And I want you to focus on the results and discussion and tell me, there may be 3, there may be 5, there may be 6, 7, 8. It can be paragraphs over paragraphs. I want you to tell me what we should remember out of that article, why it is important, what does that work that these people do, the researchers, add on the current evidence that we have, right? So what somebody again runs into you and you want to tell them what was the important points of that article. Paragraph, bullets, points, whatever you like. Focus on the results and the discussion, right? That's why I'm talking about the findings and then the inferences of those findings. And what do they mean? And tell me, which are the take-home points of that article, right? Again, pick whichever article you find more interesting. This is what I talked about. We have our third synchronous meeting this Thursday at 12 noon, 45 minutes, whether we use all of it or not. Okay? I'm going to try to cover 16, 17, 18, so I don't have 18 next week, and we only have 19 and 20. Okay? I'm going to stop sharing this, and I'm going to start sharing the first open slideshow. Give me 1 second. All right, try again. There we go. So we started talking about the health-related components, right, of a training program. So, and we talked about cardio. We also talk about resistance training. Today, we're going to talk about flexibility, okay? And flexibility, the definition is the degree to which a joint moves through normal painful range of motion. That's your flexibility, okay? And the most common way to increase your flexibility or your joint run or range of motion is stretching. And as I mentioned in the very beginning, this is a component of the health-related physical fitness, okay? Now, what determines our flexibility? The structure of the joint, right? My joint stops here. It can't move any further, right? So that will determine my range of motion. If the soft tissue around the joint is healthy or not, right? If you have an injury around your knee, that will again affect your range of motion, right? The length of the antagonistic muscles or the antagonist. Right? If I'm trying to stretch my knee, the length of the muscle, like if I'm trying to, or let's say I'm trying to stretch this, the antagonistic muscle will be my triceps. So the length of my antagonistic muscle, that will be affecting my range of motion. The temperature, of course, if we warm up, range of motion most likely will increase, and then the viscoelastic properties or the band-like properties of the mass of the tissue will definitely affect the range of motion. What do you think happens with age? So, of course, as we age, flexibility goes down, right? Also, if we consider sex, it's well known that females have more flexibility than males because of the geometry of muscles, the bone structure, and their hormonal differences as well. Also, the more active you are, the more flexible you are, and I hope that makes sense. Now, And this is a very important issue from this chapter, and I want you to remember this, is that there are benefits and there is when we talk about flexibility. So we usually have more questions than answers, as we can see here, right? So the benefits, yes, if you stretch, you'll have an increased range of motion. Cool. Now, if you are more flexible, a lot of time that will mean you have more mobility, which that will mean that you have ADL stands for activity of daily living, so that will really help you with your everyday life. Okay, and how will that happen? It will happen through enhancing the range of motion, and indirectly because it will affect your postural control. All right, so now uh, the hypermobility is a risk of um, when we talk about flexibility, but most of the time it is because you were born like that, right? So yes, hypermobility is one of the risks of flexibility, but we don't have enough evidence to link flexibility training with hypermobility. Most likely, hypermobility happens because that's how you are. Decreased strength, that's something really important. I want you, I'm sorry, to focus on this. Static stretching, especially before performance, um, most likely is not recommended because it will decrease performance. And there is evidence that shows that static stretching may decrease power up to 1 hour. And I'm not talking about one rep of one stretch, like you kept it for 15 seconds. Now, if you actually do static stretching, that most likely will decrease your power for up to 1 hour. That's not good, especially if you're playing a sport that requires power. Okay. A lot of times they tell us, right, that stretch so you don't get injured. Well, we're not sure about that either. So we can be conclusive. Also, you know that when you stretch, yeah, you are more flexible right after stretching, but after some minutes it goes away, right? Then that's why you see people at the gym, for example, they're stretching in between sets because it goes away. It doesn't stay there. Of course, if you keep doing it every day, you will have chronic effects. But concerning temporary effects, now let's talk about evaluating flexibility. Most of the time, we will do some kind of assessment, and one way to evaluate flexibility is when using a goniometer. So a goniometer will figure out the range of motion. And then after flexibility protocol, you can keep using the goniometer and see if the range of motion, the degrees went up, it increased. Now, when we talk about stretching, there are a lot of types. First of all, if we do it by ourselves, that's called active. If somebody else is doing it on us, that's passive. We get increased ROM when we get a larger ROM when we do passive than active. Okay? When I say somebody else is doing it, it can be even a device. Right? Now, the most common ones is static, when there's no movement, dynamic, well, there is movement, and then there's PNF. And I'm going to talk about PNF. I've talked about PNF before, but I'm going to talk about it a little bit more today. So here, when we talk about static, it's very common, right? It can be active and passive. Of course, usually we keep up to 30 seconds. If you're an older adult, we say up to 60 seconds because we've seen that is more beneficial just for them. 2 to 4 times, 60 seconds per exercise. Those are some examples of exercise by body part or region. And you see on the right side, there's a column with comments, which gives more information. This is just an example of a flexibility training program. Dynamic. Now we have movement. And of course, because we have movement, it can only be active. It can't be passive. Um, 5 to 12 reps. And it's dynamic, it's great. And you'll see a lot of teams incorporating the warm up, and they're trying to imitate the movements that they will do better later. So different movements for soccer, different movements for basketball, volleyball, I don't know, discus throwing, or whatever movement or sport you're doing. This is another sample of dynamic. You see the body region again, the exercise, and the comments. Now, PNF stands for proprioceptive neuromuscular facilitation. It's awesome, it's great. However, it's very technical. So, if you don't know how to do it, as I've said before, do not do it. Okay. So those PNF techniques now involve a dual process. So we have an isometric contraction, which is followed by a static stretch. Of course, we're talking about the same muscle group. It is believed that PNF can elicit a relaxation response, and it affects the neuromuscular system. And that response can occur in the prime mover, the agonist, the synergist, and or the antagonist muscles. Of course, across a specific joint. I would recommend you go online and watch a video of PNF because it's not easy for me to describe it. However, again, I want to underline that if you do not know how to do it, do not do it because it's technical. Okay, so again, we have an isometric contraction followed by static stretch. That's the most common way that we discuss PNF, at least for the purposes of this course. Now, we don't have enough evidence to promote or make a case against flexibility training. Okay, it really depends, but we should do an assessment in general, and we should determine if there are limitations due to inflexibility. Okay. Now, when you design a flexibility training program, because you are stretching muscles that are like bands, it is recommended to warm them up first so you avoid breaking a lot of muscle fibers, right? And when you're breathing, of course, as you go into the stretching position, you breathe out. And as you're coming back, you breathe in. And when we talk about posture, of course, we talk about neutral position of the spine, shoulders should remain back and away from the ears, and hips should be in the neutral and level position, depending on what stretch we are talking about. Now, there are some individuals that should not stress, but we should be aware of issues they have when we prescribe flexibility protocols. So arthritis, do not stress when it hurts, right? Do not go over that point of discomfort and pain. Practice ADLs through dynamic stretching. When there is muscular imbalance, so I'm running up my shoulders at the front, usually I stretch my pecs, and I'm trying to strengthen my um, rear delts or lats, right? So I can bring them up, because most likely I am rounding my shoulders because my chest is way stronger than my lats and my rear delts. So I have that muscular imbalance around this joint as we're talking about. So that's one way to correct that, strengthening the weak muscle, stretching the shorter muscle or the stronger muscle. Osteoporosis has to do with what? Bone density, right? And osteopenia is the beginning, let's put it that way, of osteoporosis. Of course, can affect males and females, but in females more prevalent in at least after 40, 50, when they go into menopause after 60, the prevalence kind of becomes the same. The numbers kind of level up. And in general, you know, don't push them that much that you will break some of their bones. Okay, and there are some exercises like bending forward, supine spinal rotation or twist, the plow pose. If you don't know what the plow pose is, look it up, or the cobra pose. Okay, those are kind of not allowed. If they have hip fracture or hip fracture replacement, again, it is very important to know that and adjust your protocols. There are specific movements, as you can see, that you should avoid: internal rotation, hip abduction, and hip flexion. When we do any kind of these programs, we follow the FIT-VP principle, right? Frequency, intensity, time, type, and volume and progression. Frequency, 2 to 3 days per week, 2 to 4 stretches, stretch repetitions per muscle group. Intensity, mild discomfort, and RPE will be up to 15. It's pretty high. Time, as we said, 10 to 30 seconds for everybody except for older adults. We can go up to 60 seconds, 10 to 30 seconds for PNF, and a 6-second active contraction. Type. Now, type of stretching, it really depends on the activity. We talked about the 3 types of stretching. So it has to do with what you have available, the resources, if somebody can do it on you, like passive or active, and the specific activities of your sport. Volume and progression, you see total 60 seconds per joint. We don't really have any guidelines for progression. The take-home point from this chapter is that flexibility is an essential ingredient of health-related fitness. And although the science of flexibility training may seem confusing and at times conflicting, personal trainers are urged to continue to keep pace with the changes in the scientific literature as it develops. All right. Okay, so I'll move to the next chapter, chapter 17. All right, that will be the functional movement one. And that chapter is the one that was added in the last edition of this book. And there are a lot of pictures and a lot of examples in the book. We're not going to go over all these pictures tonight, but we're going to cover definitely the main points. All right, so here, strength and conditioning programs are essential. We talk about progressive overload and, this principle and that principle. But everything comes down to sensor acuity, optimal stabilization, and mobility. Okay, so we're going to cover things like that in PED212, Analyzing Human Movement, but it's a great opportunity to just introduce you into this motor learning, right? The central nervous system. The nervous system is we usually group it into the CNS and the PNS, the central nervous system and the peripheral nervous system. As we are learning a movement, slowly, gradually, the CNS becomes automatic, so we make that movement in a more automatic way, and then we can fine tune it. Okay, just remember the first time you bench press or you deadlifted or you did anything like that, how it looked the first time and how it looks right now. There's neuromuscular coordination that takes time, but it happens. Okay, so what is proprioception? Proprioception, we've talked about before, is a hot term lately. is the sense, it's knowing where your body is in space and when it's static or when it's moving, right? And of course, we gather a lot of information, especially when we talk about sensor input from mechanoreceptors. Like I'm touching using this finger, my thumb, and I get information about temperature, about pressure, about how it feels and stuff like that. So we'll have proprioception, we have visual and vestibular information that comes towards the CNS. And as it comes towards the CNS, that becomes um, analyzed, and it can help us with body awareness. If we see it from this perspective, we have afferent and efferent input. So you see the dashed line, that's the afferent, and the solid line is the efferent. So you see that from vision and vestibular, there's information going straight towards the brain, but there's also information coming from proprioception and the mechanoreceptors, right? From the PNS, the peripheral nervous system, it goes through the spinal cord and goes all the way to the brain. So all that information now is being processed in the brain, some of it in the spinal cord, but we'll talk about it in PED212. And then we decide to react to do something. There's action potential coming down from the brain, goes through the spinal cord, it goes all the way to the muscle fibers, and we do something. But also, as we're doing something, we notify the mechanoreceptors. The mechanoreceptors get information, and they take that information and they send it back to the brain. So it's a cycle. It's a closed system, right? Again, PD319, we'll break those down a lot. All right, stability versus mobility. What I want you to remember now is that we're talking about the two extremes of the same continuum. If something is stable, it's not mobile. If something is very mobile, it's not stable. So in order for something to be stable, we have to sacrifice mobility. For something to be mobile, we have to sacrifice stability. A great way to think about it is joints. When we talk about hip, do we talk about hip mobility or hip stability? So we're designed in specific ways, right? When we talk about knee, are we talking about knee stability or knee mobility? Ankle, spine, shoulder. Think about that. We have joints that need to be more mobile, and we'll have joints that need to be more stable. Also, a lot of times when we do an activity that requires more stability, like we use a belt, we use wraps around our knees, or wraps around our wrists, and so on and so forth. But we are designed, some joints to be mobile, some joints to be stable. We need both, but in general, when we have one, we can have the other, okay? Here we have a comparison between mobilizer and stabilizers. You see fast twist, slow twist, superficial, deep, concentric, isometric, eccentric, gross movement, joint stabilization. So that's a great way to see them side by side and compare their characteristics. All right, mediators of proprioception, mobility, and stability. Now, if you are overweight and obese and physically inactive, that will affect your mobility and stability in a negative way. Okay, propensity of inhibition of stabilizing muscles. Again, the theory is that some muscles have a natural tendency, should I say, some of them to be weak and some of them to be tight, and that will affect your proprioception, mobility, and stability. Previous injury and pain, of course, and your everyday posture. Me, I'm working a lot in front of a computer, or other people are wearing heels, or I don't know, hairdressers doing this all the time, nurses are doing specific movements, and if you keep doing them again and again and again for every day, of course, that will affect all this, the proprioception, mobility, and stability. The joint structure, of course, in age, as we age, that affects all three of them in a negative way. What is the neutral position and why is it important? In general, we say that is the position of the spine that puts the body in the least stress possible. Right, that is important for that specific reason. Now, when we're trying to assess A lot of time we use body weight movement, and we have that theory, that we should start with body weight movement, and that's the great place to start any conditioning program. I'm not sure that's the case all the time, but anyway, we can definitely use them as baseline in order to do some kind of prescription, but not all the time. Okay. There are some assessments that can be static. Again, YouTube, easy to find. The plumb line assessment, right? The wall test, and you can definitely see how to do those online. Nothing really too complicated. Here you can see the assessment broken down. If you see from sagittal or anterior view, what's the setup and what are the checkpoints that you should be looking for as you're doing it. Okay, again, if you search online, you can easily find a couple of videos, and that will be way more explanatory than me trying to show it to you right now. Here we have some suggestions about postural corrections. So we have the deviation on the left, something, deviation is negative, right? And then we have some cues, and then what's the target of the stretch. So you can see, for example, you have posterior pelvic tilt. You can say align your rib cage over your pelvis. And for stretching, you should be focusing on hamstrings and abs. Here are those progressive stages for neutral postures. You can just do it on the ground. That's easy. You can do it seated and then standing. And then, of course, standing and adding in hip hinge, which is a movement of the hip. If you don't know what hip hinge is, again, look it up. That's really important to know. And then you can do farmer carries with bilateral loading, both hands. And the more challenging is farmer carries with unilateral loading. So just one side, just holding something just with one hand. All right, some other integrative assessments. We have the wall, plank and roll. YouTube can show you definitely how to do it. Teaching how to brace, okay? We talked about bracing before. That's something that I will always tell people, for example, before they just squat, brace, just keep this tight, right? Diaphragmatic breathing and some rolling patterns. How do you roll out? And I think there is in a little bit, I think, a table about that. Always check the quality of the movement as well. And when we talk about instability training, we put people in an environment which is not stable. And that, of course, challenges their stability because they're trying to maintain their balance. All right, so here, some checklists, okay? For example, posterior pelvic tilt. We have loss of neutral lordosis in the lumbar spine or flattening of lumbar spine. So if we see things like that, then we automatically think about a posterior pelvic tilt. If we see excessive arching of lower back, then automatically we think about anterior pelvic tilt. If we see knees collapsing inward, that's valgus, right? Immediately we think about that. Here we have instability training on the left column, exercise in the position, and then on the right side, we have how it would look like if you actually master it, okay? All right, let's go here. A lot of times we talk about foam rolling, and foam rolling is a great example of SMR, self-myofascial release. So we're talking about fascia, okay? And you can do it by yourself. You find some tender spots or trigger points that you push and you try to release them, okay? That has to do a lot with fascia. Here, we have the problem on the left side, and then what kind of SMR you would do and where you would target SMR to do it. So, for example, if you have a posterior pelvic tilt, you should be doing SMR on your hamstrings and your abs. Okay? So, as I mentioned before, the example above that, internal rotation of the shoulders, you should do what? You should stretch your pecs. That's the most important thing, right? All right, of course, all this do not happen overnight, and we need to encourage people to do some long-term changes, or I would say like lifestyle changes. And that has to do, of course, with work ergonomics. Again, I'm using a computer 8 to 10 hours per day, so I'm sitting all the time. I should know how to sit correctly, how high the screen should be, how high my hand, the desk should be, the chair, the back of the chair, and everything. Diaphragmatic breathing is something really important, and foam rolling, we just talked about that. And that's the end of the second chapter for tonight, which has to do with functionality and functional movement. Progressive overload should not come at the expense of proper movement patterning. The personal trainer should recognize that stability, mobility, and proprioception are requisite features of motor patterning, which are impaired by sedentary behavior, obesity and overweight, and limited variety in movement. All right. Okay, so we covered 2 out of 3 chapters, and I'm going to do chapter 18 as well, which is the personal training session component. Not a lot to describe. Some of them are really self-explanatory and kind of cheesy as well, but we'll see. All right, so chapter 18, personal training session components. In general, we have the science of personal training and we have the art of personal training. The science of personal training is what we do right now, which is, explain scientifically, evidence-based a way of how to train people. The art of personal training is take that and apply it on specific contexts. And that's something you don't really learn from a book, you learn from applying the book, which means you learn it from experience. Okay. Now, safe and effective, safe and effective, safe and effective. You should know that your protocols have to be, first of all, safe and then effective. What do I mean by that? Safety is a prerequisite of effectiveness. Nothing can be effective unless it's safe. Something, though, can be safe and not be effective. What do I mean by that? If you squat 100 pounds, right, and I prescribe you to do 100 pounds or 105 or something, that can be safe and effective because you're trying to push your PR and go from 100 to 105. If I prescribe you to do 20 pounds, that's definitely safe, but it's not effective because 20 pounds is nothing for you if you can squat 100. That's what I mean. But always think about that. All exercise prescription should be safe first and then effective. If it's not safe, it's not effective. There's no way for something to be effective if it's not safe first. I hope that makes sense. Client safety is priority number one. You should know the physical limitations in general in that specific day. You should be just sensitive to any daily fluctuation. That's exactly what I talked about. Always think, always look, always try to find information to any movement can be an assessment. So look all the time if they do something right or not today or in general. If you see something, you need to refer them. Also, don't be that personal trainer that doesn't listen to their client and keeps pushing them for no reason. Listen to them. Yeah, push them, but also listen to them. If something is going on, ask for the feedback and just adjust accordingly. Okay. Of course, plan each workout. You have to have those long-term goals that we talked about and the short-term goals, and always be proactive. Always plan. Always be ready to change it because they may not be ready physically and or emotionally. So always be ready to adapt the plan. Charting is always important for many reasons, even for legal reasons. If something happens and you have noted down, that's great. Always do the reps, the sets, everything they did, have those charts, and that will prepare you for the next workout. And that will prepare you for the next workout. It's great to have that history. Okay, not only because you can compare like baseline to whatever, but also it's very professional, and it can really help you if something bad happens, right? Always be attentive, always always focus on your client. Don't talk with your phone. Provide anything they may provide. Know all signs and symptoms of any kind of disease or any kind of event that may happen if you push them, especially. Um, and know all techniques, or at least the ones that you tell them to do, and help them out when you have to. Nothing really here. Always prefer, yeah, definitely maintain a professional appearance. And we never know enough. The more we study, the more we realize that we don't know enough. And that's the fun part, or anyway, an essential part of learning in general, right? You read one book if you think you know enough, and then you read the second book and then, oh my god, I didn't know anything. And then you think you know enough, and then you read the third book, and that keeps going on and on and on. And especially in a science like ours, things evolve. It's not, we're not studying history, you know, and history is pretty much, it doesn't change that much, right? Our science evolves all the time. Every day something comes up. We need to be able to know that, or as much as possible. Certifications, of course, advanced degrees is a way to learn more, but you can also do it by yourself. Yep, of course, keep the facility clean, it's professional, and also it's safe. We'll go back to the safe and effective. Session components: greeting, warm up, cardiorespiratory, aerobic or anaerobic, cool down phase, muscular strength, core workout, condition specific exercise, neuromotor training, flexibility, goal setting, farewell, and charting. And I'm not going to explain these a lot because they're probably part of one of your LOs. Continuity. So have a plan, but if it doesn't work out, be creative and find other ways to do it. Do not waste people's time. They're paying you, right? So if you have 45, 50 minutes to train them, just find something different. Like mid row, whatever, is not the end of the world if you cannot use a mid row machine today. Find another way to do it. Always be punctual, always be on time, greet when you meet them, and also greet them when the session is over. Be professional, right? Why do we warm up? We've talked about warm up, right? Warming up is about mainly, sorry about that, increasing the body temperature and getting ready for the main part of the workout. It has to be relevant, of course, with the main part of the workout, at least 5 minutes, and the intensity has to be relevant as well. We could use RPE or heart rate. Okay. We talked about the cardiorespiratory phase, user guidelines of SSM. We talked about that. We had a whole chapter. Cool down again, 5 to 10 minutes, depends on the conditioning phase part. Again, you can use HR and RP. Of course, medication can affect heart rate. If you're taking beta blockers, your heart rate will be lower. If you drink caffeine or you drink something that has caffeine in it, that will increase heart rate. Muscle strength and muscular endurance, we had a whole chapter about it. Don't forget that there are functional exercises as well. We should incorporate some. Here we see a continuum. Exercise that don't need a lot of skill are on the left side. Exercise that need a lot of skill are on the right side. We're not saying that if something needs a lot of skill, we shouldn't do it. If we need to do it and we're ready to do it, let's incorporate it. If we don't need it or we're not ready to do it, then don't go all the way to the right. Start from the left side and slowly go towards the right side, and as long as you need to go. You don't have to go all the way. It depends on the client, their goals, their age, their physical, it depends on the client. Always assess, make sure there are not any injuries or any issues. Talk to them, refer them if you need to, use other equipment. Don't push them if they're not ready that day. Sporting is important, especially as a lot of you said when we have free weights, right? And we need to know how many reps, we need to know the technique, the form of the person who's doing the exercise. We need to be ready to uh, pull the weight or grab the weight if we need to. Cueing is important, and you can have a lot of reasons. We can educate. It's about safety, alignment, or motivate. Like, and you can have you can deliver it in a lot of ways. Some people like visual, some people like oral, some people like both. Right. So we need to be able to deliver it in different ways if we need to. And the last one says our cue should be more positive than negative. Like actually telling them what to do, and not telling them what they shouldn't do. Although it has its utility as well. Use a variety of equipment, of course, the one that is safe to use and based on their clients and the readiness level. Core workout. Core is very important, right? And we hear about core all the time, and of course, it's a very important part of the workout. You see some examples at the bottom: abdominal hollowing. If you don't know what that is, have you ever heard about vacuums? Vacuum. So vacuums that you do in your abdominal region is a great example of abdominal hollowing, pelvic tilts, scapular depression and retraction, prone props. All of this, if you don't know what they are, just Google them or YouTube them. That will find it. It's nothing too sophisticated. Now, we may need some specific protocols for specific people, just as people who are pregnant or have issues, of course. Always remember your scope of practice, what you can do and what you cannot do. Whatever you cannot do, refer them to somebody else, to another specialist. Neuromotor training, we talked about that. We had a whole chapter. It's very beneficial. It can be static or dynamic. Everybody can benefit from this. Of course, very young people because you need the neuromuscular coordination, but also middle age as well because they're starting losing it. Can definitely benefit from that part of training. Flexibility, we just had a whole chapter about it. Goal setting, of course, it's important because you have to have the short-term goals and the long-term goals that we talked about before. Um, we talked about charting, why it is important. Nothing really great here. And this is the last slide with the take-home points. The personal trainer must strive to deliver the highest level of client care and customer service. All components of the training session should be administered sequentially and closely observed. Personal trainers should acknowledge that they are role models, educators, and motivators of clients. Therefore, they should continue to challenge themselves. I'm going to stop sharing. I know this has been a long video, 50 minutes already. So thank you for your patience. I want to wish you a great week. Do not forget that office hours are on Wednesday and synchronous meeting on Thursday. In the meantime, lift intentionally.